My name is Tony Guerrerio. I'm from Johns Hopkins, where I'm a pediatric gastroenterologist, and I'm also the co-scientific lead for the Casper Center of Excellence for Pediatric Genetic Syndromes with aortopathies. And today I'm going to talk to you about bone health in Loeys-Dietz syndrome. So the TGF-beta pathway is a signaling pathway that's affected in Loeys-Dietz syndrome. And the TGF-beta signaling molecule is present in large amounts in bone and cartilage, where it modulates the activity of osteoblasts, the cells that build bone, and osteoclasts, the cells that break down bone. It also regulates the mechanical properties and composition of the bone matrix, and disruption of this signaling pathway results in bone abnormalities. Previous questionnaire-based studies of LDS types 1 and 2 showed an increased risk of fracture, and 50% of those had a fracture by age 14 years old. So we undertook a study to look at the bone strength in patients with all different types of Loeys-Dietz syndrome. So we looked at 77 patients with different types of Loeys-Dietz syndrome, 1 through 5. About 70% had types 1 and 2, and the other 30% types 3 through 5. It was 33 adults and 44 children, and all participants had a DEXA scan to measure the bone density in their whole body, their spine, their hip, and their forearm. So there's a couple things we're going to have to understand before we talk about the results of this study. So the first is we did a DEXA scan, which stands for dual energy X-ray absorptometry, which is a bone density measuring test. So it's a nuclear medicine test. And if the score is low, it means you have low bone density or weak bones. And if the score is high, it means you have lots of mineral in your bones and your bones are strong. So if we look at a population and we look at graphing the bone density from low to high, and we look at each bone density score, the percent of the population who has that score, you'll end up with a graph that looks something like this. And the average is the score at which 50% of the population you're being compared to has a DEXA score that is higher than you and 50% is lower. So another way we can refer to the average is a z-score of 0. So if I tell you you have a DEXA z-score of 0, that means your DEXA score is equal to the average score to which you're being compared. When we compare your DEXA score, we compare it to people of your same age and sex, because we expect and we see that younger people have stronger bones than older people, and males in general have stronger bones than females. And so when we compare your bone density, we need to compare it to someone of your same age and gender. If you have a DEXA Z-score that is slightly lower than average, if we say you have a z-score of -1, it's 85% of people have a DEXA z-score higher than you. And if we say you have a z-score of -2, then 98% of people you're being compared to have a z-score higher than you. So let's look at some graphs of some of the data that we found. So these are graphs of the DEXA scores for the whole body and spine. Each of these is split into looking at adults and children. And in each graph, there's a column for each LDS type. So LDS in the whole body for adults, type 1, 2, 3, 4, and 5. Each dot is a separate person, and the box maps out the general distribution of where most of the dots are. And you can see that when you look at it, there does not seem to be much of a difference between the different types of Loeys-Dietz and the DEXA score. And indeed, we did not find that any particular group of Loeys-Dietz patients had better or worse DEXA scores than any other group. You might look at this and say, well, type 5 looks a little bit higher, but there were only 3 people in this particular study with type 5, and we just didn't have enough patients to mathematically be able to say anything with certainty. What we did see that for adults, the spine and hip DEXA scores were below average, so less than 0. However, for children, all the sites we looked at, whole body, spine, hip, and forearm, the DEXA scores were significantly below average. And about 10% of adults and about half of the children had bone density Z-scores less than -2, so about 98% of people they were being compared to had higher DEXA scores. We also looked at fractures. 60% of the patients had one or more fractures. 20% were reported to occur following minimal trauma. In children, most of those fractures were in types 1 and 2, while as in adults, they were more spread out between the different or among the different types of Loeys-Dietz syndrome. So here's a graph I showed you before. So we can see that for an adult with type 1 Loeys-Dietz syndrome, there are some of those adults have low DEXA scans and some of those adults have okay to good DEXA scans. Same thing with kids. Some of the kids with types 1 and 2 have very low DEXA scans. Some of the DEXA scans scores are okay. So is there a way that we can predict and pull out the people who might need more attention to their bone health than others? So we started to look at the clinical features that are associated with the skeletal system in people with Loeys-Dietz syndrome. And we looked at a bunch of different features, including some that aren't listed here. But what we found is these 5 features helped us, looking at these 5 features helped us predict who might be more susceptible to low DEXA score and therefore susceptible to a fracture. So starting with the fingers, we found that arachnodactyly, or long thin fingers, and camptodactyly, which is this bend in the finger where it can't be stretched out. Looking at the back, we found scoliosis and spondylolisthesis, which is where one of the vertebrae in the lower back slips off on top of one of the underlying vertebrae, and flat feet, or pes planus. And when we look at these 5 features and we just count up how many of these features the person has, so they have either 0 or 1 or 2 or 3 or 4 or all 5 of these features, and we count them up, what we find is the more of these features you have in any combination, the lower your DEXA Z score. And that's both for children and adults. We also found that's true for fractures as well. The more of these 5 features you have, the greater number of fractures you've had. So the number of these fractures helps us pick out the people who we need to pay more attention to their skeletal health. Another way we can use the counting of these skeletal features is in a decision tree. And the way these work is each of these diamonds is a question you answer yourself. Ask yourself, and then you follow the answer to this question out each of the decision trees. So if you have a skeletal count of 0 or 1, so do you have a skeletal count greater than 1? So if yours is 0 or 1, then it's no. And you can see that these people have a DEXA Z score that's not much different from 0 or average. However, if you have a skeletal count of, say, 3, so it is greater than 1, and you're a child, yes, and we just said the skeletal count was 3, so it's greater than 2, we found that those people have a Z score in general, less than -2. And so those people are people we want to be paying more attention to their skeletal health because their DEXA score is less than 98% of the people that we're comparing them to. So what is the underlying problem? Why do people with Loeys-Dietz syndrome have weaker bones? Well, I don't have an exact answer for you yet, but we did try to look and see if we can't uncover why that might be true. So there are 2 bone markers in your blood we can look at. One is P1NP, the name's not important. That's a marker of bone formation, and that did not correlate or go along with any of the DEXA Z scores. There's another marker called CTX, which is a marker of bone resorption, and that was inversely correlated with the whole body DEXA Z score. So the more of this marker you had in your blood, the lower your DEXA Z score. This suggests that there might be too much bone breakdown in Loeys-Dietz syndrome. Well, there's another group that has too much bone breakdown, and these are postmenopausal women. And with this group of people, there's a class of drugs that can help with this problem called bisphosphonates. And so what we did is we looked at 5 patients with Loeys-Dietz syndrome who, because of very low DEXA scores and a history of fractures, had bisphosphonate infusions. And if we look at these graphs, these are 5 of the different body parts we looked at by the DEXA scan. Each dot is a DEXA score that they got at different ages. So this is 10 years old, 15 years old, 20 years old. Each color is a different patient. The same color is the same patient in each graph. And the dotted line is where they were getting a bisphosphonate infusion, and the solid line is where they were not getting a bisphosphonate infusion. And as you look in this graph, you can see that it suggests that perhaps when people with Loeys-Dietz syndrome were getting bisphosphonates infusions, there was an improvement in their DEXA-Z score, and when they were not, there was not an improvement, or their DEXA-Z score went down. So this gives us a hint that bisphosphonates may be helpful in people with very low DEXA scores and a history of fractures. We, of course, need more studies, more patients, and more comparisons with people who are and are not getting bisphosphonates. So this study highlights the importance of bone health monitoring in people with Loeys-Dietz syndrome. And about a third of adults and 60% of children with LDS exhibited poor bone health with Z-scores less than -1. And about 60% of the patients in the group of 77 Loeys-Dietz syndrome patients we looked at had at least one fracture in their lifetime. Children did have worse bone health compared to adults, but we suspect that this is a referral bias, meaning that the children are more likely to be brought to medical attention than adults, and so we are picking up more children with more severe disease. We don't know if their bone health will get better as they get older. In order to answer this question, we would need DEXA scores on the same person as they got older, and clearly that's going to take us some time to answer that question. Some data I didn't show you was that males tend to exhibit a greater propensity for low bone density in the spine than females, and so we may need to pay more attention to males in terms of lower bone density than females. So we suggest that there's a bone density assessment be performed as part of routine care in patients with Loeys-Dietz syndrome, and that you evaluate and optimize the nutritional status in patients with Loeys-Dietz syndrome. So we want to make sure that you're getting adequate calcium in your diet. We want to monitor your vitamin D and supplement it if it's low. This should be measured at least yearly. We want safe, so again, certain exercises are safe for people with Loeys-Dietz syndrome. We want some weight-bearing physical activity that's been shown to strengthen bones. And not that there aren't enough reasons already to avoid smoking and alcohol use, but here's another reason to sort of toss onto that pile of to avoid them, and that it affects bone health. There are other disorders that people with Loeys-Dietz syndrome are more susceptible to, such as asthma and inflammatory disorders like eosinophilic esophagitis. Some of the medications, such as steroids that are used to treat these, can have an effect on bone health. And so it's important to discuss that with your providers as part of your treatment plan. If someone with Loeys-Dietz syndrome does have a very low DEXA score and is having spine pain or is at risk in other ways for a vertebral compression fractures, they should be screened with lateral spine imaging. And for those with low bone density, a history of fractures, or at high risk for fracture-related morbidity, we suggest referral to a bone health specialist for consideration of bisphosphonates. So I'd like to thank Allison Boyce, who is a pediatric endocrinologist and chief of the Metabolic Bone Disorders Unit at the NIH, who saw and evaluated all of these patients. I'd like to thank our two statisticians, Allison Matea and Erica Brattain. I'd also like to thank Hal Dietz and Gretchen McCarrick for their participation in this study, and Pamela Guerrerio also as part of this study as well. And lastly, I'd like to thank all of the patients who participated in this study. Clearly, this study exists entirely because of your participation. And so again, I would really like to thank you all for participating and helping us learn more to take better care of people with Loeys-Dietz syndrome. Thank you.